patient's defenses are too weak to kill off. May affect all aging group. Значит, it means that and primary and secondary TB by pathogenesis. Ну вот there you understand, primary and secondary. Так. Next classification by morphological and X-ray presentation. Miliary TB. From word millet, Latin millet, то есть it means grays, small grays. Значит, many small lesions in organs, in parenchymatous organs. And from 19th century pathologists to look like millet spreads. The term is now applied when the upper is appear a small rounded shadow on the X-ray of chest. No, in 19th century we don't have X-ray examination. Значит, after autopsy, after death, patients with miliary TB, autopsy, and doctors see many small white or yellowish grain in parenchymatous organ. But why name miliary? Yeah? And in nowadays we have X-ray examination. We see small foci in. Second form by pathomorphological and X-ray presentation, disseminated TB. То есть miliary TB and disseminated TB. Написали, да? Sankipali. Do you finish this page, Sankipali?
Yes, ma'am.
Так, все. Значит, and classification by ways of dissemination of MBT spreading. Значит, hematogenous, lymphogenous, bronchogenous, and mixed. Lymphogematogenous, lymphobronchogenous, no, combined, да? Maybe combined. No, you know, all these three ways, I think you know. Так. By clinical appearance. Значит, classic disseminated tuberculosis. Cryptic miliary tuberculosis. Disseminated miliary tuberculosis in immunocompromised patients. Так, ну, again, pathogenesis, то есть hematogenous, lymphogenous spreading, typical hematogenous spreading from a recent primary infection. This may occur by way of the lymph nodes and lymphatics or by a tuberculous lesion eroding blood vessels. But every time I ask you how Mycobacterium appearance in the lumen of bronchial tree of blood vessels, what first appearance acute granulomas that give for us caseous necrosis. A caseous necrosis destroyed all tissue. If close to lymph nodes, we have bronchial tree or lymph nodes or blood vessels, значит, acute granuloma destroyed wall of blood vessels or bronchial tree. То есть first appearance erosion, after erosion, small foramen, microforamen, and through this microforamen, да, caseous mass together with MBT penetrate wall of blood vessels, lymph vessels, and etc. What's how appearance Mycobacterium in lumen? Так, значит, reactivation, то есть, please remember, we have primary TB and secondary pathogenesis. Вот reactivation, it is secondary TB, да? То есть miliary TB maybe and primary and secondary. Reactivation of old tuberculosis lesion post-primary with erosion of a blood vessels. Reactivation may occur in the patient's defense are lowered, for instance, by HIV infection and another disease, malnutrition or old age. То есть risk factors in the secondary TB, you know, that reduced immune protection, resistant and begin reactivation. То есть L form transformate to normal form of MBT, and normal form begin quickly multiplying, produced caseous mass. Так, and spread into the bloodstream after surgery on organ contains a tuberculosis lesion. Always give chemotherapy before surgery to reduce the number of TB and continue treatment after operation to kill all bacilli. Значит, by clinical appearance we have acute TB sepsis, acute TB sepsis by clinical form classification. It is the most severe generalized form of miliary TB. It is usually developed in immunosuppressive patient, HIV, or small children, especially when massive household contact. Так, acute TB sepsis. Ну, то есть, and primary and secondary TB give for us acute TB sepsis. То есть, small children and adults, person with HIV, maybe with depressed immune system. Так, continue pathomorphology, да? No, there you see very good picture with white, very, very small, such grain covered all lungs symmetrically, да? То есть miliary foci have mainly productive reaction, so they don't fuse together. Their borders are clear and cavity don't form. Miliary foci are located in the both lungs, symmetrically localization. So first we speak about miliary TB. Then pathomorphology of disseminated TB. Continue, да? Так, there you see photo. Photo during surgery operation, case of disseminated TB, autopsy it is, no, it is not surgery operation, it is autopsy, oh, excuse me. Так, and show for us involvement of intrathoracic lymph nodes. То есть вот это white, вот this, значит, close to parenchyma. Parenchyma тоже have many white focuses and involving intrathoracic lymph nodes, increasing in size. Так, значит, next photo тоже after autopsy. Значит, in these lungs we find small cavities, да, вот one cavity and second cavity. Ну, one cavity, значит, empty space, а вот this cavity filled by caseous necrosis. Так, next photo тоже continue autopsy. Show for us kidney, да? Kidney next parenchymatous organs. And there we see small foci, millet. Abdominal TB, disseminated TB, miliary disseminated TB, it is mesenteric lymph nodes. Mesenterial lymph nodes. То есть you see very round, many small foci. Так, next photo about intestinum, да, intestinum. What they show for us caseous ulceration, small hemorrhages, and fistula. Вот это вот fistula, 2 lumen of intestinum. 2 lumen of the intestine, I think. Так, значит, clinical appearance, please continue. Clinical appearance. The first clinical presentation are non-specific, chest pain, dry or productive cough, breathlessness, general symptoms as high fever, weakness, loss of weight. Так, don't remember that high fever, we have duration such wave. То есть 1 week maybe high fever when formate new foci or maybe formate cavity. And next week we have subfebrile temperature. То есть such wave, don't remember that. Because during 1 month we don't have high temperature, 40 degrees. But every time increase and then decrease. The onset of fever and other symptoms can be gradual, usually over weeks. Sometimes there is enlargement of the liver and spleen. То есть involvement hepatosplenomegalia maybe. Так, clinical presentation of cryptic disseminated TB. Cryptic disseminated TB. Значит, diagnosis of cryptic obscure disseminated TB may be missed in patients without typical presentation of disseminated tuberculosis. Often the correct diagnosis is made only at post-mortem. The fever is often mild or irregular and may continue over a month, and there is often anemia. There are usually no other helpful physical signs. Ну, то есть less clinical appearance, да, less clinical appearance. The illness may not be visible on the chest X-ray, and lesions may only appearance after weeks or months. То есть вот это вот first stage of miliary disseminated TB, if we speak about pulmonary TB, first acute stage, only change pattern of lung parenchyma, да? Only after some days, 1 week, 2 week appearance, small foci. First 2 week, first 10 days without foci. Так, laboratorian methods, да? Значит, what we used. Ну, first, simple microscopy, cell-Nielsen reaction. Так, simple microscopy and FED. Then, second, but in patient with miliary TB or cryptic disseminated TB, то есть first period, maybe negative, да? First period, 10 days, we don't find. Then modern genetic methods, modern genetic methods. No, you know, modern genetic methods. No, in commonplace it is gene expert, MBT, rifampicin, and Hein test. Hein test, and our third, culture methods, then, because we begin more detailed investigation. Так, значит, additional investigation, we invite a doctor, ophthalmologist doctor, and due to hematogenic dissemination in the bottom of eyes, we see what this very good picture in the bottom of eyes, net of capillaries, small white foci. Small white foci detected in 30% of acute classic disseminated TB, but usually are absent in cryptic disseminated TB and immunocompromised patient. Immunocompromised patient. Так. But все равно invite ophthalmologist, invite and try to find evidence. Значит, X-ray, first X-ray examination. Значит, what we see in X-ray. Вот это вот observed X-ray of chest, да? Anterior-posterior projection, soft film. And focal shadow are detected in both lung, right and left lung. They have different size, unclear border, tendency to fusing. Вот так вот fusing, да? Small foci, then after some time infused in one more large. TB cavity are often present. What second photo? First appearance in upper part. Why? Because all changes appearance first in upper part and then begin in medium and low part. What there for cavities you see one cavities, and in this in upper part one small cavities, да? Ну, not small, вот это average уже, two ribs and two intercostal space 4 centimeter, 5 centimeter. Так, sometimes maybe signs of pulmonary tissue fibrosis. Fibrosis. And loss of affected lobes volume. Ну, вот why lost? Due to fibrosis, pneumosclerosis, то есть shrinkle, да, shrinkle our lung tissue. Deformation of lung root, what especially in the second photo, you see deformation of mediastinum, displaceness at mediastinum to the left lung, да, displaceness. And normal shadow of heart тоже change, да, change shadow of heart, such tense string. Formation of pleural adhesions. Pleural adhesions. What, no, very small, not so bright, but there you see so small high intensity, including, так, and dislocation of mediastinum. What, please compare what in upper part photo, normal mediastinum, normal shadow of heart. And in the second, you see how change shadow of mediastinum, да, то есть you must know normal shadow of heart, and you understand what this. First, dislocate to left side and heart of shadow of heart change such string tense, да? Туда вот in upper part. Hang to upper, fibrosis of upper part. Fibrosis in upper and left and right lung, you see. Так, значит, if it is primary TB, affected intrathoracic lymph nodes, the source of disseminated may be visible. Так, Sankapali, do you finish this?
Yes, ma'am.
Thank you. Так, next photo. Next photo. Next photo у нас... Так, что у нас тут? Three picture. A, B, and C. То есть A, it is observed X-ray of chest anterior posterior projection soft. B, it is lateral projection. It is absorbed of chest, but lateral projection. Да? And what C, it is computerized tomography, transverse projection. Transverse projection. Значит, all of these additional tomogram and computerized tomogram help to put more exactly diagnosis. Значит, we see in all these three photos diffused bilateral interstitial changes of lung picture occur during the initial period of disease, to its acute stage. Then diffuse small miliary foci appearance after 10 days, да, you remember, enlarged intrathoracic lymph nodes, what especially very good you see in computerized tomogram, вот это, enlarged lymph nodes, increased bronchial tree, pattern of bronchial tree, and may be often detected, especially in children, да? Ну вот in absorbed you see вот такой вот unclear border, infiltrative shadow in the place of lung root, in the place of tracheobronchalis and bronchopulmonary group, вот это вот. And right and left sides. Так, and what lateral position you see increasing of intrathoracic lymph nodes, тоже вот здесь вот вы you see, да? Behind heart. Так, next. Значит, secondary TB, what immunocompromised patient, it means it is adult person with secondary TB. In late stage of HIV infection, symptoms of respiratory system involvement may be absent at all. Without cough, without breathlessness, chest of pain, and etc. But which symptoms? Dominate symptoms of general intoxication, да? Ну, you remember, да, this loss of weight, appetite, night shivering, night spitting, general weakness may be so severe that inability to work, fever, loss of weight, night sweating. But if you make X-ray examination, you find disseminated foci, small foci, maybe cavities you see, but without symptoms of respiratory system. Так. Закончили, ребята? Так, значит, continue our secondary TB, immunocompromised patient with HIV. Sputum test. Ну, again, sputum, simple microscopic Cillinisan reaction. by all methods, microscopy, culture methods, fast methods, the genetic methods, usually negative, Then tuberculin skin test, if we make, that at late stages of HIV, значит, give for us false negative, то есть non-informative this method, methods. Chest, о господи, что-то не слышу я. Chest X-ray and, maybe another там magnetorized or computerized tomography may stay normal until the last day of life because cellular immunity is suppressed, but TB granuloma formation is the reaction of cellular immunity. Так, дальше у нас идет. Значит, if there are not other reasons which may cause these symptoms of general intoxication, physician must think about tuberculosis and start anti-TB treatment as soon as possible by World Health recommendation. Так, дальше, значит, without adequate treatment, outcome of disease is fatal. And finished by death after several weeks. Because HIV and TB severe form, it is very, very quickly and very severe condition, quickly finished by death. For this patient, difficult to drink this anti-TB treatment because we have side effect, if you remember that. The side effect, vomiting, hepatotoxic effect. То есть вот for HIV patients especially difficult. Так, значит, диагноз. Значит, how we put diagnosis, clinical diagnosis, confirmed by pathomorphological examination of HIV patients. TB foci are usually found in many different organs, lung, плевра. Вот это у нас lung, плевра. А что это? Так, brain, liver, spleen, kidney, and etc. То есть all extrapulmonary parenchymatous organs. Значит, differential diagnosis with which disease? Значит, first, pulmonary disseminated carcinoma, non-tuberculous granulomatosis, sarcoidosis, allergic or idiopathic alveolitis, Maybe professional disease, silicosis, да, if you remember name of professional disease. Silicosis тоже give very, very small foci in lung parenchyma. And diseases of connective tissue. Ну вот, disseminated sarcoma тоже in lung parenchyma, many small metastatic foci, metastatic foci. I quickly listed pages that I sent for you, да? Так, please quickly write lecture number 6, pulmonary TB, кавернозис, фиброкавернозис TB. Так, и где у нас тут? And secondary TB, да, вот, what begin from secondary TB, I sent for you photo, да, in WhatsApp. If you want, make quickly photo, because I вообще lost my voice вообще уже. Так, then, mainly occurs in adults older than 30 years old. Please remember what this age, remember 30 years old, secondary TB. Значит, may be located in single system, maybe pulmonary, maybe extrapulmonary. TB process spread by natural canals, bronchogenic way, in TB of kidney by ureters, or maybe contact way, да? Ой. Так. Дальше у нас идет. It does not have tendency to spontaneous recovery. Usually there is tendency to the destruction of affected organ and impairment of loss of its function. Так, prognosis of secondary TB depends on early detection and adequate treatment. Ты что, не ушел, что ли? Господи, так. Значит, two ways, да? Two ways, you know. Ну, you have this photo, endogenous reactivation is reactivation of all TB infection in residual TB changes. And sometimes early tetrad may be detected by sputum microscopy. What it means, early tetrad? In sputum we find Mycobacterium tuberculosis changed, то есть in another form, elastic fibers, calcium salts deposition, and cholesterol. Changed MBT, it means L form, да? Commonplace. And exogenous superinfection, repeated sometimes numerous infection with new strains of MBT, development of new tuberculous foci in intact areas of lung tuberculosis, of lung tissue. То есть before maybe in childhood, adolescence, we have old foci, and then appearance new foci, да? And elimination of drug-resistant strains of MBT, primary drug resistance in new TB cases. Так, then, ну, risk factors you have, да, this page, значит, HIV, malnutrition, drug abuse, long alcohol intaking, diabetes mellitus, and other severe disease, oncology disease, да, special. long taking of steroids, cytostatics, hereditary factors, presence of disease, susceptibility genes, allocated mainly in BDR locus, and etc. Так, next, значит, ну, non-severe, значит, we have severe and non-severe. Значит, non-severe, not more than 2 segments of lung tissue are affected only. The size of apatite in the chest X-ray film is not more than 10 centimeters. And severe by World Health classification, severe 3 and more segments of lung tissue, and size in X-ray film more than 10 centimeter in quadrant, то есть square. Так, clinical presentation тоже very good picture, да, you see. Значит, first it is Koch with production, maybe discharge, purulent discharge, а maybe hemoptysis, да, уже purulent and hemoptysis, chest of pain, in severe infiltratus breathlessness, fever, тоже please remember fever, such wave, high, then subfebrile, high, subfebrile, loss of weight, loss of appetite, night sweating, weakness. То есть symptoms of tube intoxication, every week appearance, every evening, excuse me, уже я ничего не соображаю. Так, diagnosis of pulmonary TB. Значит, how we put clinical diagnosis, please remember algorithm of World Health Organization, first complaint, then clinical appearance, then physical examination, and laboratory test. Значит, first, microscopy, simple microscopy, then gene expert methods, то есть find DNA, да, nucleic acid, then DST by culture or FMD to detect drug-resistant form. Then drug susceptibility, drug resistant, да, вот это вот называется. Tuberculin skin test positive, maybe. Maybe positive, more than 10 millimeter, and false negative if it is more severe form. False negative in more severe form. Так, X-ray findings. In X-ray we find opacity, значит, which opacity? Maybe small foci, maybe infiltrative shadow, maybe cavity, and bronchogenous dissemination in low part. То есть all types of pathological shadow. Increasing of pattern of lung, increasing linear of bronchial tree, involving lymph intrathoracic lymph nodes, то есть many pathological shadow. Так, вот алгоритм. Again, in first lecture number 2, we include algorithm, and again include algorithm in this page. Значит, ну, I think you have, да, this algorithm. Значит, first week, more than 2 week Koch with sputum production. Then we have simple microscopy and gene expert methods, because it is fast method. Gene expert give for us next day results. Значит, if you find 3+, it means active TB, we send to hospital. What treatment? Especially first initial phase, 2 months, we treat at hospital. We isolate our patient, да? Not in polyclinic, and continue our investigation in hospital, after treatment, again, after initial phase, after 2 months, again, X-ray, if we don't find polyclinic to polyclinic. Continuation phase. No, if our patient, if we didn't find in sputum Mycobacterium tuberculosis by simple gene expert, we give at polyclinics second day X-ray of chest at polyclinic, да? And then if it is maybe not exactly TB disease, we give broad spectrum antibiotics except of rifampicin and 8 fluoroquinolone, да? And then again after 10 days X-ray, control X-ray, and if it is good improvement, stopped all clinical symptoms, значит, we don't find TB, but after X-ray and after antibiotics, continue cough, temperature, and etc., then we again try to find evidence, and if you don't find evidence in culture methods, we send to hospital where produced bronchoscopy, operation maybe, and etc. Да? Так, next. У нас next. X-ray findings of pulmonary TB. Значит, in X-ray, вот это вот observed X-ray of chest, anterior, posterior projection, soft film. Soft film. Значит, what we see? We find pathological shadow in first intracostal space, вот здесь вот, да, of lung. Алло? Ага, привет, привет. Да, так, ничего. Я сейчас лекцию читаю, а ты что хотела, Альфиса? Слушай, вот, честно говоря, я забыла про это. Я вот что-то, какой-то у меня это... И ты мне скажи, где надо это проверять? Я что-то даже не помню, куда ты там сына отправлял. На мою почту отправили, да? Ага. Хорошо, я исправлю. Просто я сейчас что-то приболела, вот эти вот недели какие-то тяжелые. Ой, это, ну сейчас вот еле лекцию читаю, голос уже у меня совсем сорвался. Ну ты мне сколько времени дашь? Я потому что не успею, честно говоря, вот если... Ну то есть в субботу можно будет, да? До субботы, да? Все, потому что у меня сейчас все время зачеты идут, и я прям устаю на этих зачетах. Хорошо, извини. Да, давай. Ага. Так, excuse me, students. Так, X-ray examination, да? То есть вот in left lung, то есть у нас вот это вот left lung, да? First intracostal space in apex, то есть вот это вот apex, да? We see small foci, да? Small foci. And what name of this? Small foci, вот это вот, ну, not so good фото, конечно, not so good фото. Значит, NC, fibrosis of surround lung tissue, то есть вот это вот, да, то есть high intensity including, it is fibrosis. And usually, and you see infiltrative shadow in the place of lung root and linear bronchial tree, linear. Это уже у нас increasing of bronchial tree. Так, значит, first, second, and sixth segment, first, second, and sixth segment of upper part, it is typical localization. Значит, next X-ray. Ну, there you see two photo. Значит, in first photo, form of opacity in the lung tissue may be round or oval. Вот это вот round, а вот это oval, да? Its intensity may be medium or high. It may be heterogeneous structure. Ну вот there you see high intensity in low part. Вот это вот oval, high intensity. There high, вот это вот weak average intensity, так? And вот calcification, вот это вот, I think, calcification. Вот здесь calcification. Вот in the place of intrathoracic lymph nodes, тоже including high intensity calcification. And sometimes there are calcification in the lung root. Вот здесь вот, да, вот это вот calcification. And surround lung tissue. Так, вот это вот у нас туберкулома, ребята. Вот это вот похоже на туберкулому. Round. А, нет, это round shadow connection with bronchial tree. It is infiltrative TB round form. То есть such primary TB complex, but without increasing intrathoracic lymph nodes. То есть we don't see dumbbells. If you see only two part in lung parenchyma round shadow and connection pathway to lung parenchyma, it is, and first you know age. If it is adult person, it is not primary TB complex. It is infiltrative TB, round form. Так, next X-ray show for us. What triangle shape you see, да? Вот это вот triangle shape, including right lung upper part. Ну, medium part, да? Between two lobes, right lung have two lobes. Значит, between two lobes begin to be inflammation of connective tissue, and how we understand it is pericystitis. То есть name of this pericystitis. То есть low part, good border, intensity weak and average non-homogeneous structure, but upper border unclear, unclear, да? То есть how we understand it is not intralobal pleuritis, it is pericystitis. То есть it is TB pneumonia, right upper lobe. No, it is, значит, infiltrative TB pericystitis, what another name, with involving intrathoracic lymph nodes, Limited by intralobal pleura, да? Так, дальше, next у нас. Next picture. Тоже it is infiltrative TB by classification of Кошечкин infiltrative TB. You see there opacity, upper lobe, left lung. Вот это вот upper lobe, irregular. Size maybe 6 centimeters because three ribs and 2 intracostal space, да, то есть 6 centimeter height, ну, maybe 7, да, and то есть it is non-severe form, да, how you understand, non-severe form, left lung, which is related with lung root, то есть we have тоже connection with lung root, so should be distinguished with central lung cancer. Central lung cancer. Понятно, да? Ну, cancer, значит, more high intensity, more density formation, да? There вот formation weak and average. Так, дальше у нас идет X-ray. X-ray of chest. What you see, значит, shape of our chest deformate, asymmetrical. Yes. Вот это вот chest. Please stop your это, cooking. Что это такое? Так, вот это chest asymmetrically, то есть shrinkle upper part of lung, parenchyma, and we see asymmetrical changes of chest. Значит, we see high intensity, including in upper part of right lung. То есть вот здесь фиброзис уже у нас начинается, фиброзис, склерозис, да, why, то есть shrinkle our lung parenchyma, reduced volume of right upper lobe, да, right, reduced volume due to this change chest, condition of chest. And вот это вот уже maybe cirrhotic changes, да. Вот, вот in tomogram you see good border between two lobes. Maybe before we have infiltrative lobitis, but after treatment maybe finished by fibrosis, massive fibrosis and pneumosclerosis. Так, дальше у нас идет. Next, значит, cavity TB. Cavity TB. No, it is picture, not X-ray of change, picture, autopsy. We see in upper part of right lung cavity, and in surround tissue many small white Yes, lecture, please try to connect with me, хорошо? At 12 o'clock. Давай. Так, значит, вот это cavity with very good capsula, external layer, good capsula show for us that it is sclerosis, да? Fibrosis, sclerosis, chronic cavity. And free space, and internal contour. Вот это thickness of capsula you see in low part, more large thickness of capsula, more than 1 centimeter, characterize chronic cavity. Так. And what in upper part, many small white foci, тоже it is begin maybe from focal TB and then finished by cavernosis. And we see connection with lung root, with bronchial tree. But we see infiltrative shadow, connect lung root. Так, TB cavity, continue, X-ray, значит, вот это вот observed X-ray of chest rigid film, and we see cavity in upper part, вот это вот in upper part of right lung, да? Значит, what I think it is fresh forming cavity, похоже на fresh forming cavity, big reservoir of MBT, it's contain about 10 in, ну, то есть почти one leg, да, получается, of mycobacterium, то есть миллион, да? And it is a very big bacterial population. That condition is not stable. То есть in the center produced caseous necrosis. In this caseous necrosis, many mycobacterium, thousand bacterium saved in this place. Значит, what we must do? We must make operation, lobectomy or segmentectomy. Это вот. Так, значит, cavities form when necrosis involved. The wall of an airway and semi-liquid necrotic material is discharged into the bronchial tree. It is usually clogged up and may infect others. This infected material may seem other parts of the lung via the airway to produce a tuberculosis bronchopneumonia. The risk of spread of infection to not infected person from individuals with cavity tuberculosis is very high. Значит, progression of cavity leads to subtotal or total destruction of lung, impairment of lungs function, and death from severe respiratory failure. Respiratory failure, acute disease, it is lung bleeding тоже lead to death. Значит, pathogenesis of cavity. Pulmonary cavity is never initial form of tuberculosis. It is always a consequence of some other pulmonary form of TB, such as TB pneumonia, disseminated TB, primary TB complex, TB of intrathoracic lymph nodes, тоже plus lymphogenic cavity. Condition of TB cavity formation. Focus of caseous necrosis in the lung tissue. Liquefaction of caseous mass caused by hyperergic reaction of lung tissue. Rupture of liquefied caseous mass in the drainage bronchus. Ну, how you understand liquefaction? То есть caseous mass, it is very dense formation, space, the wide density position. Liquefaction, it means what this caseous mass transformate to liquid, more watery condition, and maybe deposit in low part of cavity. What liquefaction, да? And due to this liquefaction, very quickly they penetrate through fistula to bronchogenous way, hematogenous way, and etc. Так, pathomorphology. Here you see histological investigation, cavity, free space, and how much layers consist. То есть first three layer. First layer, internal caseous layer, then second layer, medial layer of specific cells, то есть gigantic cells, да? They produced, what second layer, produced caseous necrosis. Gigantic cells, macrophages, lymphocytes, epithelium cells, and etc. What this second layer produced caseous necrosis. And external fibrous layer, it consists of fibrotic fiber cells, fibroblast, господи, что я, fibers, fibroblast, connective tissue, lymphoid cells, contains blood and lymphatic vessels. What three layers of chronic cavity? Chronic cavity have three layers. Acute cavity have two layers. Так, classification. Значит, depend from size. First part, size of cavity, small. No, begin from 2 centimeters in diameter, then medium 2-4 centimeters, large 4-6, until 6, more than 6, gigantic cavity. Да? No, I think it is very easy classification by size. I think you remember that. Так, classification by time of development. То есть first appearance, acute cavity, and name of this cavity, elastic by pathomorphological structure. Because in X-ray, we don't say elastic. We don't know in X-ray it is elastic or not. In X-ray, it is ring-like shadow. By pathomorphological, you see these histological changes. Né? It is elastic, acute. External layer of connective tissue is very thin, And second, chronic cavity. In histological investigation, fibrous chronic cavity, thick layer of connective tissue, да, вот это вот thick layer, and thin area of caseous necrosis in its wall. Thin area is internal cavity. Это вот internal cavity, да. Так, вот don't, значит, don't confused with X-ray name. In X-ray it is ring-like fresh forming, then chronic. А вот это вот pathomorphological changes, elastic and then fibrocavernosis. Так, what it means syndrome of lung tissue destruction? Значит, clinical appearance, да? То есть of cavity, fibrocavernosis or cavernosis TB. Значит, first, cough with sputum production. Cough with sputum production. Then, different caliber vessels in the affected area of lung tissue. No, different sounds, да? Different sounds in auscultation. Often hemoptysis, lung bleeding, mycobacterium in sputum. Так, то есть cavity give for us sputum production, maybe hemoptysis, maybe purulent with tetrad early, да, please remember, cholesterol, там, fibrodin, collagen fibers, and etc. And massive bacteria discharge, massive by simple microscopy, more than 100, да, уже. Clinical symptoms, значит, of extensive cavitary tuberculosis. Значит, first, symptoms of tube intoxication, you know, I think, да, weakness, loss of weight, loss of appetite, expressed night sweating, subfebrile temperature, change by gastric temperature, cough, production of blood sputum, and breathlessness, да? By general examination, deformation of the affected sides of chest. То есть asymmetrical changes of border, да? Asymmetrical changes due to fibrosis. During percussion and asymmetrical moving of lung, да? During percussion, dullness of sound, consolidated areas of lung are detected. And by auscultation, bronchial breathing, crepitation, vessels crackless. Ну, тоже many different sounds, да? And maybe soft, very small, такие вот dry vessels, moisturized vessels. Maybe crackles, maybe bubbles, да? Maybe small crepitation, and etc. No, what these people, very exhaustion, you see, very exhaustion, narrow of intracostal space, the asymmetrically body chest, asymmetrical. No, what this picture show for us prisoners, I think, the prisoners. At prison, very close contact and finished by this fibrocavernosis. Так, диагноз of cavitary tuberculosis. Ну, first, simple microscopic Nielsen reaction, да, first. Then, just skin test. Then, culture methods, especially drug resistant, drug susceptibility and drug resistant form to find. Then CBS, increasing of erythrocyte deposition rate, leukocytosis, lymphocytosis, and etc. Then next, ну, urine analysis тоже, да, urine analysis. Show for us maybe proteins, leukocytosis тоже in urine, да. Chest X-ray due to amyloidosis of kidney, так тоже urine, blood and urine analysis. Chest X-ray, cavitary lesions, mostly in upper lobes of lung. Bronchogenius foci, signs of lung tissue fibrosis. Ну, то есть many pathological shadow you find, and foci, small and infiltrative shadow, and cavity, acute, chronic, and etc. Bronchogenius dissemination and fibrosis. Так, ну, the photo about Cynison reaction, red roads on blue background, you know, да, this photo, да? Ну, this вот фото, ну, not, вот это high increasing, вот this not so high increasing, да? Так, дальше у нас идет X-ray diagnostic. Ну, very good photo. You find cavity, upper part of right lung, diameter more than 4 centimeters, то есть 1, 2, 3 ribs уже 6 centimeters, да, то есть it is large cavity. And we see two contour, internal contour and external contour. Вот external contour unclear, да, weak intensity, perifocal inflammation, то есть fresh forming cavity, вот это вот. Around occurs a little fibrosis in upper part. Then bronchogenius dissemination in lower part. Вот здесь вот тоже bronchogenius dissemination. То есть it is one large cavity. Так, next photo. Anterior posterior projection observed, да? And you see deformation of chest. But there you see deformation. Increase volume of right lung. Compare right and left lung. Значит, volume of right lung it decreased. Many ring-like shadow in the lung tissue. Many ring-like shadow. Вот это вот ring-like. Вот это вот тоже, да? Значит, вот это вот ring-like shadow. Size of cavity 2 centimeter, вот это 2 centimeter. And more big, вот это large 6 centimeter, да? Wall of cavity thick. Unclear, вот это вот clear border, вот здесь вот у нас clear border. Decreasing of volume of affected areas of the lung tissue. Вот это вот decrease volume, да, вот upper part of right lung. And many foci of bronchogenius dissemination, what in right lung, low part, and left lung, low part. You see increasing of bronchial tree, infiltrative shadow left lung, тоже medium part, вот weak intensity, non-homogeneous structure. And increasing of bronchial tree, linear, many linear, то есть involved intrathoracic lymph nodes, bronchial root, and formate cavity. Так, cavitary TB. Так, next cavitary TB у нас observed X-ray of chest soft film, anterior posterior projection. Значит, you see in upper part right lung. Gigantic cavity. Вот это вот gigantic cavity, да? Ну, not so slim, то есть slim capsula, maybe 5 millimeter thickness. Irregular contour тоже. No, irregular shape, no, oval maybe, да, oval shape. And many small foci would surround cavity, many small foci fused together. And pleural changes there, maybe we find, да, pleural changes, emphysema in low part, Cor pulmonare, вот здесь у нас cor pulmonare, да? То есть changes shape of mediastinum, changes shape of heart. Вот such tense. Вот это вот cor pulmonare у нас, да? Leads to respiratory failure and heart failure development. If you see changes of mediastinum, changes heart, what so many intensive of bronchial tree, то есть begin pneumosclerosis in this place, да, значит developed heart respiratory failure. Outcomes. Так, значит, I think we stopped in this page, да, students? And next, please, you say for me where we stopped, да? Outcomes of cavity TB. Do you listen me, Санкапали?
Yes,
Санкапали?
ma'am.
You listen me.
Yes, ma'am. Yes, ma'am.
Так, значит, вот это last page, lecture number 6, да? Lecture number 6, page number 35, да? Please remember.
Yes,
And then next week, we begin read from lecture number 6, finished lecture number 6, and begin lecture number 7, да?
okay, ma'am.
Do you understand, да? Значит,
Yes, ma'am.
вот lecture number 6 у нас 53 slides, то есть уже 20 slides left to next time. 20 slides left. Так, что у нас? Differential diagnosis next, да? Ну, outcomes, you understand. Healing may be closed. If don't closed cavity, значит, begin bacterial population, legions without bacterial populations. Ну, то есть sanitary, it means a clear cavity without caseous mass, clear cavity after treatment, and cirrhotic TB if closed and developed fibrosis TB, and if don't, page number 35. Значит, if don't close, develop cirrhotic TB with heart respiratory failure and outcomes. Так, значит, все. I think we stopped in this place, да, students?